5 minutes on his paws. And in most cases, that's all it takes to help your senior cat start jumping onto the couch again without hesitating. It's not medication. It's not a supplement. It's a technique you can already do right now, with your own hands. And the reason it works is going to surprise you, because it involves something almost no cat parent knows about how a cat hides pain. Feline arthritis is, without exaggeration, one of the most underdiagnosed conditions in all of veterinary medicine, and it's not because vets don't know to look for it. It's because a cat doesn't limp the way we expect him to. A dog with arthritis limps visibly, favors a leg, whines. A cat with arthritis does the opposite of all of that. He gets quieter, he jumps less, he starts avoiding high places he used to love. And the problem is, all of that together looks exactly like what we already expect from an older cat. He's just calmer now. Must be his personality mellowing out. Except it's not personality. Most of the time it's pain, perfectly disguised as calm. Before I tell you what this massage actually does, drop your guess in the comments. What do you think is really going on inside your cat's paw when he hesitates before jumping? I'll tell you if you're right in a minute. I know a lot of you have already been through this. You took your cat in for a routine checkup. The vet did the exam, and at some point mentioned early arthritis, maybe even in passing, without much weight in their voice. And you walked out with a diagnosis, but no real plan. No practical instruction for what to do day to day, beyond keep an eye on it and come back if it gets worse. That's not a failure on your vet's part. It's simply that routine checkups are short, and hands-on intervention at home rarely makes it into a 7-minute conversation. But that leaves you in a frustrating spot, knowing there's a problem, without knowing what to actually do with that knowledge. So let's fix that right now. Here's why massage actually works, in terms that make biological sense. Arthritis is, at its core, inflammation and stiffness in and around the joint, cartilage wearing down, synovial fluid becoming less efficient at lubricating movement, and, over time, the muscles around the joint tightening up as compensation, because the cat's body instinctively tries to protect the painful area by limiting its movement. Regular physical touch, applied with light, consistent pressure, does two things at once. It stimulates local blood circulation, which helps carry oxygen and nutrients to the area and reduce the buildup of inflammatory fluid, and it helps keep the soft tissue around the joint looser, instead of letting it stiffen further from lack of movement. That's not my opinion. It's the same principle behind manual physical therapy used in larger animals, scaled down to something that makes sense for a cat. Let's get into the technique, because doing this wrong can simply not work, or leave your cat uncomfortable and associating the experience with something negative, and that's the last thing you want. Always start at a moment when your cat is already calm, ideally already relaxed in your lap or lying near you, never right after being startled or in the middle of energetic play. Use your fingertips, never your whole palm, with pressure similar to what you'd use to feel someone's pulse. Light, but present, not a superficial stroke. Start with the paw itself, making small, gentle circles on the pad and between the toes, where tension tends to build up the most. Then move slowly up to the wrist, and if your cat is still comfortable, continue upward toward the shoulder or the hip, depending on which paw you're working on, always in small circular motions, never pulling or stretching the joint. It's worth treating the front and back paws a little differently, because the joints involved aren't the same. In the front paws, the shoulder tends to be where stiffness builds up first, especially in cats who still attempt to jump even while hesitating, so give that area a little more time, always in small, slow circles. In the back paws, the hip and the knee are the most common wear points in senior cats, and that region tends to respond well to slightly firmer pressure than the front paws. Still light, but noticeable enough to actually reach the deeper tissue around the joint, not just the skin. The most important sign that you're doing this right is your cat himself. Purring, relaxing his body, closing his eyes. That's a green light. Keep going. If he tries to pull his paw away, tenses up, or moves away, stop immediately in that specific area and don't push through it. That doesn't mean the massage isn't working for him. Often it means that particular joint is sensitive enough that even light touch is uncomfortable right now, which is actually valuable information to bring to your vet, not a sign you did something wrong. 5 minutes a day is the target, but you don't need to do it all at once. 2 sessions of 2 or 3 minutes, at different points in the day, tend to work just as well, sometimes even better, because your cat doesn't get tired of the sensation and stays with a positive association. In the first few days, it's completely normal for your cat to only tolerate a little at a time. Some paws might not accept touch yet at all, and that's fine. Start with whichever one he allows. The goal isn't to force a complete protocol right away. It's to build trust first, and let the duration grow naturally as he associates that moment with something good, not with discomfort. And here's something I need to make clear, because safety always comes first on this channel. Massage never replaces a veterinary evaluation, especially if you notice visible swelling, heat in the joint, or intense pain at even the lightest touch. In those cases, stop the massage and get your cat to the vet before continuing. There could be something beyond common arthritis going on, and that needs to be ruled out first. This is exactly the kind of thing the Reading the Face of Pain chapter in the SEE method walks you through, step by step. Not more things to memorize, just a real way to actually know instead of guess. Because the same attention you're learning to give your cat's paws right now is the same attention that helps you catch pain anywhere else in his body, before it becomes something more serious. If you've ever wished you could simply know what your cat is feeling, instead of guessing, that's exactly what this method was built to solve. Check the first comment pinned at the top of this video. That's where the link is. I need to be honest about something before I close out this video. When I first started recommending massage for feline arthritis, part of me doubted it would make a real difference. It seemed too simple, too easy, for a problem we usually associate with expensive medication or more complex intervention. I remember clearly the first time I suggested this to a cat parent, an older woman with a 13-year-old cat who could barely make it onto the windowsill he used to sit on all day. And I was genuinely surprised when, 2 weeks later, she wrote to tell me he'd climbed up there on his own again, unassisted, for the first time in months. I didn't expect it to make that much of a difference, but after watching the same pattern repeat itself, cat after cat, owners reporting the same kind of shift, cats attempting jumps they'd given up on, becoming more active within the first few weeks of consistent routine, I stopped doubting it. It's not magic. It's simple biology, applied with consistency, that most of you never had the chance to learn because nobody ever stopped to explain it. And here's what I really want you to carry away from this video. Your cat doesn't need to suffer in silence just because he's good at hiding it. He's not going to cry out in pain. He's not going to limp visibly. He's not going to do anything dramatic that forces you to notice. He's just going to, little by little, get a bit quieter, a bit less willing to climb, a bit more still, and that's exactly why it falls on you to learn to notice, because he's never going to warn you the obvious way you might expect. So here's what I'd ask you to do this week. Pick a calm moment in the day. Start with just one paw, 2 minutes, and watch how he responds. If he relaxes, keep building the routine gradually from there. If you notice any sign of intense pain at the touch, or swelling, book a vet visit before continuing. And if he already has an arthritis diagnosis, talk to your vet about combining this massage with whatever treatment he's already on. The two work well together, not one instead of the other. And one last thing before you start. Manage your expectations fairly with yourself. Improves in days doesn't mean your 13-year-old cat is going to jump around like a kitten overnight. It means that, with real consistency, you tend to notice concrete signs of less stiffness, more willingness to move, maybe him attempting a jump he'd given up on, within a week or two. That's already a huge win, even if it looks small from the outside. Progress with arthritis is never a straight line, and every cat responds at his own pace. What matters isn't the exact speed, it's the direction. If this helped, you're already one of the cat parents who notice. That's what I call everyone who watches this channel, because you clearly are one. Subscribe so you don't miss the next one, and tell me in the comments, has your cat shown any of these hesitation signs I described here? I read every single one, and honestly, that's often where I find the next thing that genuinely needs to be its own video. Your senior cat didn't choose to get quieter because he stopped loving you, or because that's just how he is now. He's doing the best he can with a body that hurts, in a way he's never going to be able to tell you with words, and now you have a real tool, in your own hands, to help with that. This isn't a replacement for your vet. Think of me as the friend who tells you exactly what to ask them,